Welcome to the Thriving Through Change podcast, where menopause isn't the end of something, it's the beginning of a new chapter. Each episode, we bring in real life insights to help you better understand what's happening in your body and what you can do about it. Hello, everyone, and welcome back to the Thriving Through Change podcast. I am super glad you're here, and thank you so much for tuning in. And we are obviously filming this live stream at 8 a.m. on a Monday morning. So you could be on your way to work, you could be on a morning walk, or maybe if you're listening to the recording, you could be laying up late at night, yet again, having another night sweat. And if that is you, I think this will be a really beneficial episode for you. But regardless of where you are or what you're doing, we really appreciate you wanting to spend time with me. And today we're going to be talking about one of the most recognized and common symptoms of menopause, but also a very misunderstood one, and that's hot flashes. And most people think of hot flashes as simply feeling warm. But if you've ever experienced a true hot flash, you know that that's rarely the whole story. It can literally feel like someone flipped a switch in your body. One minute you're perfectly comfortable, super normal, and then the next minute you're peeling off layers, your face is bright red and you're sweating through your shirt, and then almost immediately afterward, you can't stop shivering, you're really cold. And these hot flashes can interrupt meetings, they can wake you up several times every night, and they can make you feel really anxious going out in public. And for many women, they start long before she even realizes she's going through perimenopause. So today I want to answer a few questions. Why do hot flashes happen? What exactly is your body doing? What tends to make them worse? So what are the triggers? And then most importantly, what actually works to make them better? So how can we lessen the severity and the frequency of these hot flashes? So with that, let's go ahead and dive right in. And one thing I have to commonly remind women of is how common hot flashes are. They're incredibly common. Roughly 3 out of every 4 women will experience them throughout their menopausal transition. So if you are experiencing them, you're not imagining them, you're not weak, and your body isn't broken in any way. It's actually responding exactly the way biology designed it to respond, just under a very different hormonal environment. And the problem isn't so much so that your body forgot how to regulate temperature. It's more so the thermostat has become much more sensitive. So let's take some time to go over some physiology. But don't worry, I'm going to keep it really simple as I can, simple but thorough. So inside your brain, there's a small area called the hypothalamus. And think of this as your body's natural thermostat. It's constantly checking, am I too hot, too cold? Do I need to sweat or do I need to shiver? And normally, there's a very comfortable temperature range where nothing happens. Your body just stays very balanced and very stable. Estrogen is a key player in keeping that thermostat stable. So think about it. You go through perimenopause, your estrogen starts fluctuating, and then it eventually declines after menopause. That thermostat becomes incredibly sensitive. So let's imagine your home thermostat. Normally, it doesn't turn on the air conditioning just because the temperature changes by half a degree. But imagine someone goes in and changes the settings so that every tiny temperature change triggers the AC immediately. That's essentially what's happening in your body. Your body isn't actually overheating, it's just your brain thinks that it is. So once the brain believes you're too warm, it immediately activates these cooling mechanisms. So blood vessels in your skin will widen. This is why your face, neck, and even your chest suddenly becomes a bright red. more blood rushes to the surface, and then the sweating begins that you know all too well. And this is your body trying to cool itself. And then afterward, once all of that heat has been released, many women suddenly feel like they're shivering, they're freezing cold, they can't warm up. And that's because your body overshot the target. And it's one of those reasons why women often say, man, I went from burning up to wanting to grab a blanket within 5 minutes. And that's completely normal. Again, it's your body responding in the way that it thinks it should. And one question I get very frequently is, why are my hot flashes so much worse when I'm sleeping? And there are a few reasons for this. Our body temperature naturally changes overnight, and sleep itself changes how we regulate our temperature. And cortisol, the stress hormone, can also influence nighttime symptoms. So think about it. If your thermostat is already extra sensitive, you're going through menopause, those normal nighttime changes can easily trigger a hot flash. So that causes you to wake up drenched, you change your clothes, maybe you change your sheets, you finally fall back asleep only for it to happen an hour later, super frustrating. And over time, this poor sleep becomes one of the biggest contributors of fatigue, mood changes, weight gain, and brain fog during menopause. And sometimes it's not the hot flash itself that is the biggest problem, it's more so the sleep disruption that follows. And not every hot flash happens randomly. Many women do notice certain patterns. Some of the most common triggers include some obvious things, things like alcohol, spicy foods, large amounts of caffeine, stress can be a big contributor. Obviously, warm environments, heavy blankets, let's see. Poor sleep, smoking, and even dehydration. And this doesn't mean you necessarily have to eliminate all of these things forever and ever. But learning to pay attention to your own patterns can be incredibly helpful. Sometimes women even like to keep a simple journal and they quickly notice these patterns. So, man, I always have worse hot flashes after I drink alcohol. Or, geez, they're always so much worse after I've had a terrible night's sleep. Those patterns give us something we can actually work with, and you can start to promote certain behaviors and then stay away from other behaviors. So, now that we understand why hot flashes happen, let's shift gears a little bit. And I want to talk about something practical. So, I like to think of this as your cool down toolkit. One of the biggest misconceptions I hear is that women are looking for that one thing that is going to stop their hot flashes. And unfortunately, it just doesn't work that way. Instead, think of managing hot flashes like filling up a toolbox. Every tool you utilize may help a little bit, but when you use several together, it can make a big noticeable difference. So let's go ahead and walk through some of my favorites. And the first one kind of surprises people, but eating smaller, more frequent meals can be super helpful. So, have you ever noticed you feel really shaky or overheated when you've gone way too long without eating? This is blood sugar swings that can actually make your nervous system more reactive. So, eating balanced meals throughout the day, especially if you're someone who skips breakfast or if you have to work through lunch, eating more consistent meals can help keep your energy and your body's stress response much steadier. And you don't necessarily have to eat multiple 6 meals every single day, but avoiding those dramatic highs and lows in your blood sugar can make a meaningful difference. And while we're on the topic of food, let's talk about breakfast. So, a breakfast that's mostly carbohydrates like a muffin, sugary cereal, or even just coffee, that can send your blood sugar on a roller coaster first thing in the morning. So instead, aim for about 25 to 30 grams of protein at breakfast. Think eggs, Greek yogurt, cottage cheese, maybe a protein smoothie. Heck, you can even grab like leftover chicken from the night before, if that's your thing. But this protein helps stabilize your blood sugar. It helps keep you fuller longer. And many women find that they simply feel more balanced throughout the day when they optimize protein in the morning. And another question I hear all the time from patients is what foods help with menopause? And unfortunately, there isn't one miracle food. There are foods, however, containing compounds called phytoestrogens. And these phytoestrogens are naturally occurring plant compounds that can weakly interact with estrogen receptors. And they're nowhere near as powerful as your body's own estrogen, but some women do notice modest improvements when they consistently incorporate these foods in their diet. These are things like flax seeds, soy foods, chickpeas, even edamame. And the key word here is consistently. This isn't something where you eat tofu once and the hot flashes disappear forever. Consistency really is key. And I think this is just another kind of supportive piece of the puzzle. Another easy trick is layers. So instead of one heavy sweater, wear maybe several lighter layers. So it sounds really simple, but if a hot flash hits you while you're in the grocery store or sitting in a meeting, you'll be much happier when you can pull off one layer rather than feeling like really trapped under a bunch of clothing. Natural fibers also tend to breathe a little better than synthetic fabrics, so think cotton. And I'm also a huge fan of having a little portable cooling option. So women like to carry around little handheld fans, cooling towels, cold packs, even a frozen water bottle, whatever works best for you. Some women will keep them in their purse or in their car. It's just one of those small things that until you're halfway through a hot flash, you don't realize how incredibly grateful you'll be for having like that fan or that cold pack. And also, let's talk about night sweats a little more. They really deserve their own conversation. If hot flashes are interrupting your sleep, the environment of your bedroom really becomes a part of your treatment plan. So, really try to keep your bedroom cool if possible. Use breathable pajamas, moisture wicking sheets can also be super helpful. Some women even like cooling pillows or mattress pads. The goal here isn't luxury. You shouldn't have to go out there and spend a ton of money. The goal is uninterrupted sleep. Because once sleep improves, so many other symptoms typically improve too. Sleep really is the foundation. And let's see, also lukewarm showers. So, lukewarm showers before bed can actually be super helpful in helping you release excess heat gradually rather than abruptly. It's often more times more helpful than like a very hot shower that can actually trigger a hot flash afterward. Also, one technique that's supported by research is paced breathing. So, if you feel a hot flash starting, instead of immediately tensing up, try slowing your breathing. So, take in a slow breath through your nose for about 5 seconds, then breathe out slowly for another 5 seconds, and try to continue that over the course of several minutes. Will that stop a hot flash every single time? Probably not. But many women find that having that pace breathing decreases the intensity of the hot flash and just helps them feel more in control. I also encourage women to become little investigators. So try to track your symptoms maybe over the course of 2 weeks. And it's nothing fancy. Just try to ask yourself questions and jot them down. Things like, when did the hot flash occur? What were you doing? Had you just eaten? Were you stressed? Did you drink alcohol? Were you outside? And a lot of time these patterns appear faster than people expect when they document them and keep track of them. And then finally, think ahead. So if you know you're going to be attending like an outdoor wedding in July, or if you're going to be giving a presentation or traveling or going to a crowded event, try to prepare. Take the advice we're giving you. Do things like wear layers, bring that cooling fan, stay hydrated, and choose lighter clothing. Sometimes for women, simply having a plan kind of lowers your anxiety, and that alone can reduce how reactive your body is in the case of a hot flash. So that was a lot of lifestyle recommendations. I'm going to keep the ball rolling with lifestyle, but let's talk a little bit about nutrition. So I wanted to talk a little bit about the recipe that we included in this month's newsletter. So this is our cooling berry and flaxseed protein smoothie. And I didn't choose these ingredients just because they taste good together. Every ingredient in this recipe has a purpose. So let's go through all of them. Let's start with the base. We have almond milk. And if you want that extra nutritional boost, you can switch for soy milk. Remember, soy contains those natural phytoestrogens, which again are those plant compounds that weakly interact with estrogen receptors. And these phytoestrogens are again by no means a replacement for estrogen, but we do find that when they are regularly incorporated into a diet, we see improvements with menopause type symptoms. We also have protein powder. And honestly, this is probably the most important ingredient. Getting enough protein, especially at breakfast, as I said, helps stabilize your blood sugar. It supports your muscles and may reduce some of the energy swings that make the menopausal symptoms feel even worse. And then we have mixed berries. So mixed berries are packed with antioxidants that support just overall health and even blood vessel function. And I like to keep the berries frozen. That just seems really refreshing when you're having a hot flash. A nice cold smoothie, I think would be, again, refreshing during a hot flash. Then we have ground flaxseed. This is yet another phytoestrogen rich in fiber and healthy fats. And again, the research is a little mixed, but these phytoestrogens will bind with estrogen receptors to help with symptoms, also supports things like heart and digestive health. You can even throw in some chia seeds, again, extra fiber and healthy fats, a banana for natural sweetness and potassium, even spinach. When you add spinach to a smoothie, you don't really taste it. It just gives you that extra nutrients. And I really love this smoothie because it checks off so many boxes. Again, it's high in protein, rich in fiber, full of antioxidants, and hydrating. And it's free of those common triggers for hot flashes like caffeine and alcohol. And I don't want to oversell the smoothie. The smoothie alone isn't going to eliminate your hot flashes, but it's just a great example of how small intentional nutrition choices can support your body during menopause. Sometimes it's not really about finding that one miracle food. It's more so about consistently building meals that help you feel your best. And I just think this smoothie is a really great start. And let's talk about stress. This is one area that I think deserves more attention. Stress itself doesn't cause menopause, but stress absolutely influences how our nervous system responds. So when cortisol stays elevated, our bodies become more reactive. Many women notice their hot flashes are dramatically worse when they are experiencing stressful weeks. And that doesn't mean you have to do hour-long meditation sessions every day, but simply taking 10 minutes for yourself, doing something you enjoy can be helpful. Things like walking, reading, prayer, or stretching, just anything that you enjoy that can help calm down your nervous system can be super helpful throughout menopause. Now, let's talk about the elephant in the room, and that's hormone replacement therapy. So there has been so much confusion over HRT over the years, and the good news is our understanding has evolved tremendously. So for women who are appropriate candidates, estrogen therapy remains the most effective treatment option for hot flashes. Nothing else out there works quite as well. And estrogen does a lot of other great things. It helps with obviously hot flashes and night sweats, but it also helps with sleep, mood, vaginal dryness, cardiovascular health, cognitive protection, and just overall quality of life. And again, estrogen helps stabilize your body's internal thermostat. And this allows your body to not respond so dramatically, even in subtle changes in body temperature. In short, optimized estrogen levels should equal less hot flashes. And that doesn't mean every woman should take hormones, though there are situations where estrogen isn't appropriate. And we'll talk about that in future episodes. But your personal medical history matters, your family history matters, and your goals matter. And that's why every treatment plan should always be individualized. Every woman should be treated on a case by case basis. And if you can't take estrogen, the encouraging news is we have other options. So there are several non-hormonal prescription options out there that have good evidence behind them. And one group of medications we often use are certain antidepressants. And it's important to understand that we're not necessarily using them in this case to treat depression. We're using them to treat hot flashes. So we typically use much lower doses when treating hot flashes. And some of the medications include things like low dose paroxetine, escitalopram, venlafaxine, or desvenlafaxine. These work directly on those temperature regulation pathways at low doses. And they typically reduce both the frequency and the severity of hot flashes, usually within a few weeks. And while they don't work quite as well as estrogen therapy, they can make a meaningful difference, especially for women who, for instance, have a history of a HER2 positive breast cancer, or just have another reason they shouldn't be on hormone therapy. But like any medication, they can have side effects. So it's important with any prescription medication, including HRT, to talk to your doctor about whether any medication is a good option for you. Another really good option is gabapentin. So, gabapentin is a well established non hormonal option for hot flashes, and it's particularly useful for women who suffer from a lot of nighttime symptoms of hot flashes. Clonidine is yet another option. It's not used so much anymore just because there are better options, but it is an option. And there's a few newer medications for hot flashes that are non-hormonal called Veoza. And you've probably seen the commercials on television, but what's so exciting about Veoza is that it targets the temperature regulation pathway itself rather than replacing your hormones. And it's just another great example of how menopause care continues to improve for women. And a lot of women ask me about supplements. So, or natural options. Supplements can be super helpful as well for women, more so if the symptoms are mild to moderate. And this month we highlighted a few options that are frequently used for patients. The first one is called Femerin. So, Femerin contains botanicals that do a lot of great things, supports hormone balance. It also helps with heart, bone, and antioxidant support. And then we have Estrovera. I commonly recommend this. This is a plant-based option that has some clinical research behind it in lessening the severity of several menopause symptoms, including hot flashes. And as with any supplement, quality matters. Even though these are over the counter options, it's always worth discussing them with your healthcare provider prior to starting them. And one thing I never want women to believe is that suffering through menopause is somehow expected. I hear women say all the time in consults and at the counter, my mom went through it, my grandmother survived it, so I guess I have to power through it as well. No, you don't have to. Menopause is a normal life stage, but debilitating symptoms are not something you simply have to accept. We have solutions. There are lifestyle changes, there are medications, there are supplements, there are treatment plans that can be individualized for you. At the end of the day, you deserve to feel well. And that's something I always like to teach here at Hawthorne Compounding, not only how you can feel better, but also that you deserve to feel better. And at the end of the day, we want to help you feel your best. So that's kind of where I'll wrap up the meat of the of the presentation. But before I wrap up, I wanted to share some exciting news with you. We're thrilled to welcome Kira as our newest member of the hormone consultation team. She'll be serving as our patient care coordinator, and she's going to help patients navigate appointments and make sure your experience is as smooth and supportive as possible. And we're super excited to have her. She's already been a really great asset, and I'm looking forward to you meeting her. And as always, I hope today's conversation helped you understand not only what hot flashes are, but why they happen. Again, knowledge is empowering. When you understand what's happening inside your body, menopause starts to feel a little less mysterious and a little less overwhelming. So if today's episode was helpful, please share it with a friend or a sister, a coworker, or just someone navigating the season of life. And if you have any questions about hormone therapy, supplements, or whether one of these options might be right for you, we'd love to help. So thank you so much for listening to this episode of the Thriving Through Change podcast. I hope that you will go out there and take care of yourself, stay cool, and tune in next month. We'll be talking about one of the most important but often overlooked topics of menopause, after menopause, that women deal with, and that's heart health, so cardiovascular health. And this is where I'll wrap things up. So thank you again so much for tuning into this Thriving Through Change podcast. Again, I hope you go out there and stay cool, and I will see you next time.